Namaskar, Swagatam. I would like to welcome you all on our 471st journey. This is our milestone. Pranam, sir. Vishnu Prasad Sharma ji ko namaskar.
Namaskar, Pawan ji, namaskar.
Pranam, sir. Pranam, sir. Due to your cooperation, mentorship, guidance, and contribution, we are here on this milestone of 471st webinar. Thank you very much. I am really great. We are really grateful. This platform is yours. Today, our subject is also unique and experts are also unique. All three experts are energetic, dynamic, youngsters and will guide us, inspire us on AYUSH for emergency. No doubt, unique subject. Without wasting much time, I would like to request Professor Vishnu Prasad Sharma ji, President Vishwa Ayurved Parishad Assam, ex-principal Guwahati Ayurvedic College, and member NCISM. Welcome, sir. Welcome. Now stage is yours.
Namaskar. Namaskar. Good evening to everybody. Respected Professor V.K. Agnihotri ji. Respected Dr. Pawan Kumar Sharma ji. Distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this evening webinar on AYUSH for emergency. Today is a very important subject. In this webinar, we have very important eminent speaker. I want to welcome Dr. Ankush ji, Assistant Professor, Department of Shastravitta, Ayurved College, Coimbatore. Welcome, Dr. Ankush ji. Next, I want to welcome Dr. Rajkumar Wali, Assistant Professor, Department of PTCR. BLDEAS AVS Ayurvedic Mahavidyalaya, Vijayapur. Welcome. Next, I want to welcome Dr. Aneesur Rehman, Madni, Associate Professor, BLDEAS AVS Mahavidyalaya, Vijayapur. I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this evening webinar on AYUSH for emergency. It is the most important subject. We are waiting here from this eminent speaker regarding AYUSH for emergency. So I welcome once again all of you to this evening webinar. Namaskar. Over to Pawanji. Namaskar.
Thank you. Thank you for your blessing, sir. Your welcome speech is like a blessing for us. It accelerates the speed of webinar as well as it really inspires us to do so. Thank you. Thank you very much,
okay,
sir.
Thank you, Pawan.
Sir, एक request थी in the meantime.
हाँ, बोलिए.
Would you like to spare 2 days time or 3 hours, 23 and 21st?
Okay, 23, I have a meeting from morning. There will be one big meeting, so I'll be busy. I have to
Evening,
deliver
7 to 9.
lecture there also. 23rd, at what time?
7 to 10.
Evening 7 to 10.
Right, sir.
अच्छा. तो वो क्या करना है, क्या बोलना पड़ेगा वहाँ?
जज बनना है सर.
अच्छा, जज के लिए तो नहीं. उसके लिए तो आप दूसरे हो. ठीक है, हेल्प करेगा कैसे बन, लेकिन थोड़ा बेस्ट रहेगा.
Thank you so
much. ठीक.
Now I would like to request Professor V.K. Agnihotri sir to start the program. Welcome. You both are.
Thank you, Professor Pawan Sharma ji. Namaskar. It's our great pleasure.
Namaskar.
Namaskar, sir. Namaskar, sir.
Namaskar.
It's our great pleasure to join 471 first webinar on today evening. And one more pleasure is that today's strength is I am seeing that per second persons are joining, and it is younger most persons are most of the time, and the new face. Our initial address on today's webinar is this, that we are celebrating on the topic Ayurveda for emergency. Whenever anybody hears the word emergency, he himself at the same time get himself scared. A certain type of untold, unseen situation is said to be an emergency. But since Ayurveda for emergency word is written, our pleasure is that there is not a word which is missing as clinical emergency. But for the human being, there are certain emergencies in their life, and that is social emergency, financial emergency, sometimes family emergency, and so many things are there. And this is the Ayurved's unique concept, that it is always giving direction and rescue with so many professions, that which is to be done, which should not be done like that. So our principles part, our do's and don'ts of Sadvarta and all that, they are equally important and manageable for any sort of social emergency. So goes the case with the financial emergency. It is very clearly said that if you are limiting yourself within your resources, the economical and social emergency will not take place. So many directions are there with the view that we should not go earning money by unfair means. So many things are there. If we do this, there may be a other type of emergency, and say raid of ED and CBI and other things can take place. So one should be very clear on mind, because Ayurveda is one thing which is covering every sector, nook and corner. Not simply that we have got a sudden a case of epistaxis, and Ayurveda is there to instill the Durva Swaras in both the nostrils with a pressure, and with its effect of hemostasis, it will cover. Clinical emergency, so our pleasure is this, that how many our guest speakers, they are distinguished one, and they will pour their knowledge, but how many persons are going to touch this sector which I am touching, that apart from clinical emergency, how many emergencies are there and takes place in the life of human being, and how Ayurveda is responsible to manage all these things. With these initial words, I welcome you all, especially our guest speakers, Dr. Ankush ji, Dr. Rajkumar ji, and our Dr. Aneesur and Madni ji, along with our all dignitaries who have joined our platform and are joining and will join and visit our YouTube also. They all are our most respected audience, and we thank them all. So thank you so much. Over to Dr. Pawan Sharma ji.
Thank you, sir. Thank you very much. We have started this AYUSH SAMRIDDHI International Webinar Series to negate the negativity of pandemic COVID-19. When COVID-19, now so many waves and so many new names have to come in front of us. We don't know when Janta curfew will be repeated. We don't know when lockdown will be repeated. And again, that export packaging for dead bodies will come like plastic packing. So we are really celebrating every day. Today is World Trauma Day. And trauma is directly related to emergency, where our society is not believing on Ayurveda for emergency. That is the problem. Whenever emergency, medical emergency name comes into the mind, generally a hospital written over there, emergency is only the way out to reach there. Previously, when I have seen my grandfather, Rajvedya Scindia family, Vedya Hukum Narayan Misra ji, he was keeping potlies with him, various type of potlies, and I have seen in front of me, unconscious person is awakened due to that potly treatment. So many times they have repeated, but this is the unfortunate situation that due to our Jamnagar and Indore, Pure, that potlies were not discovered after his death, that what was the what potli, because no ingredient were written, no nothing were written, but he was very expert to deal with the emergency cases through Ayurveda. At that time of 1960s and 70s, allopathy was not so popular in Gwalior. So I would like to request Dr. Ankush first. Welcome, Dr. Ankush. Now we would like to listen from you and learn from all of you. Thank you.
Thank you. Thank you so much, sir. Thank you. Shall I share my screen, sir?
Sure, sure. All co-hosts can mute and admit anybody. Yes, your screen is visible. You can go for slideshow.
Yeah. So it's visible, right?
Yes, clear.
Yeah.
Go for slideshow.
So yeah, it's in slideshow, sir.
No, it is not in slideshow. Your PowerPoint is visible.
Okay.
And this event will be live on YouTube. So please circulate YouTube link to maximum persons.
So now, sir?
No, no.
No.
Your
Sorry,
PowerPoint is visible.
enlarge it.
Any co-host can admit and mute anybody.
So just a minute, I will.
Yes. Slideshow, upper side that.
Now is it visible, sir?
PowerPoint is visible.
But here in my
You enlarge it, sir. Enlarge it.
sir, actually no. In my screen it's enlarged. I don't know why it's not visible.
For us, it is not showing enlarged.
It
So
says
now
the
is it?
full screen slide presentation mode. You touch that.
Yeah, sir. Actually, here in my screen it's fully.
No, we are seeing the whole of the footers and say footers also.
Sorry, 1 second share.
Click the first slide in center. You see, you can get it enlarged.
Now is it okay, sir? Hello.
Yeah, visual. You please proceed with this. And meanwhile, you can check that it can be put to the presentation mode, and then it will be better.
Sir, is the slides changing?
No, you change. You go for the change.
Actually, in my screen it's fully there. It's in full slideshow mode only, and screen slides are also changing. Don't know.
Okay, okay, no problem. It happens sometimes, but you please start your presentation.
Yeah, sure.
Yes, please start. Ankush ji,
Yeah. Hello.
please start.
Yeah, is it visible now, sir?
Yes, visible. Your PowerPoint is always visible, not on slideshow. PowerPoint is
Actually,
visible, slides are visible. No problem.
okay.
Please proceed. Yes,
Okay.
moving.
Now it's
Slides
moving,
are
right?
moving.
Okay.
Yes,
Okay.
moving.
Okay. So sorry for the interruption. It's a technical error, I think so, because in my screen it's changing. There, what happened, I don't know. So thank you all of you to invite me to this session. And first of all, I pay my regards to Dhanvantari and all my beloved gurus, my parents and my well-wishers, all of who are here and here to give the blessings. So I pay my regards to them. So here we do have a very unique topic on this World Trauma Day, that is emergency handling, an Ayurvedic approach. So first of all, as we know, what do you mean by an emergency? An emergency is nothing but it's an unforeseen combination of circumstances or the resulting state that calls for immediate action, and an action that has to be taken at any unforeseen combination of circumstances is emergency. And we know certain conditions in our body itself will act as emergency, like this. Yes, the neck stiffness or those things which are very much adherent to our body, and that forms a crisis. So emergency is nothing but it's a crisis. It's a way of crisis. So emergency management is nothing but crisis management too. And sometimes many diseases or many conditions like anxiety, back pain, and asthma also act as the crisis. At this point of time, the emergency medicine plays an important role. Emergency medicine is a medical specialty or a field of practice based on the knowledge, skill which are required to prevent, diagnosis, as well as manage acute and urgent aspect of illness and injury affecting the patients of all age groups with a full spectrum of undifferentiated physical and behavioral disorders. It's very important to know this. So, what is the role of Ayurveda in emergency condition? So, what do you mean by Ayurvedic emergency? Does Ayurveda have any emergencies? The answer is yes. Any medical practice to have the emergency conditions. Ayurveda enlists the disease crisis state as two. One is Upadrava and the second one is Arishta Lakshanas. The Upadravas may lead to the patient into the unforeseen troublesome condition. This you can relate it with the first what you meant by emergency. So when the Arishta Lakshanas are the symptoms which denotes a bad prognosis. And here, another thing, what emergency can be dealt in Ayurveda? As a medical science, we know Ayurveda do explain the emergencies of all categories as mental, physical, and emotional also. An emergency tackling depends upon the ability of medicine, a skilled physician, and the equipment. And when this disease crisis occurs, Charakacharya has clearly stated that the lack of equipment or attendance, the disease will turn to crisis. If there is incapability of patients are there, that happens. If there is lack of physician skills, it leads to crisis. Or if there is non-availability of management processes there, it also leads to these kind of things. And if there is delayed treatment schedules, of course it leads. And this makes the curable disease as incurable and crisis establishes at that particular point of time. So the skills of a physician are very important for us developed equipment can be produced, and attenders should be employed also. So here my focus on this particular PowerPoint presentation is how to make the Ayurvedists to identify the proper medicine of crisis management and research when government policies are discouraging. What's the policy making nowadays? We know many of the Ayurveda medicines that we use and the ingredients are banned by the government are not available due to its inadequate usage. For example, Mrita Sanjeevani Sura is not at all available with full ingredients in the market. And Pushkara Mula, the natural cortisone producing one, is banned totally. So many more names of these extinct or rare drugs are also there. Ayubena got banned. Even we know the gold rates are also increasing day by day. And of course, the burning issue, the mercurial drugs are getting banned because of so many regulations in our governmental sectors. So what does Charaka Acharya has laid a principle over this Ayurvedic management of crisis? He has put forward that whenever any crisis occurs, the guru or the lekutva discrimination is done at the first. For example, he has done it in the Gulma, you can see. The major portion, the attended first, then the lighter should be attended, or the lighter problems can be dealt. The disease management is done along with or in due course also. The Vata, which is a major dosha, is always in the emergency. The above context makes us to focus on two more areas while understanding this emergency. So that we need isolation of emergencies in Ayurveda. Ayurveda emergencies are classified as 1, the disease of bad prognostic symptoms causing inconveniences, like in the status asthmaticus. The second one is the sudden bleeding conditions which are developed due to trauma. As we know, today is the World Trauma Day. The physiological disturbances like forcebright or sunstrokes also acts upon to the emergencies, or the drug reaction like allergies or anaphylaxis, or the procedural malpractices like which happens in panchakarmas. So drug distribution, how the distribution of drugs is there. Mainly we know the drug potency and its distribution plays an emergency role, and it depends upon the fast-acting alkaloids by isolation. Second, through its absorption by the methods of preparation. The target reaching process should also be there with the help of administration. And drug interaction. It's very important. Unfortunately, now all these are done, it becomes modern instead of Ayurveda. So as a mindset is that Ayurveda means it's a crude drug distribution process that's going on. So what should be our plan of action that has to be taken part? The plan of action is a two-tier program. 1, the methodological research of enlisted Ayurveda drugs in the emergency are to be tested and under test conditions. And the admissible drug usage and the procedural protocol recordings at time to time, that means database should be there. So any medicine is a chemical. Always remember, any medicine is a chemical and is susceptible for either action or reaction. That is very important in aspects. So we can develop a operation plan in Ayurveda emergencies. First of all, of course, we have to attend all the patients and we have to give emphasis upon to the doshas. Vata, of course, the pain or the pain management should be done. Pitta, the burning sensation of the local applications, so when the sedations can be done. And in Kapha, when heaviness increases. So we are stuck here as we do not have effective pain management or sedative drugs, but we are not explored to its authenticity method. There are so many trucks which are very acting and very effectively undergoing in these conditions. If the presenting symptoms has many established management or the administrative, like for example in status asthmaticus, you can go for the Shamula Taila Matravasti, or the Tura Patradi Dhupa you can give, or Kanagasava plus Pushkara Mulasa, which is very effective in these conditions. But nowadays, we are not at all using the particular compo, or either because we don't know it, or otherwise we are not aware of the fact. So what are the plans for the emergencies? Of course, emergencies are always emergencies. And are unplanned, but how to tackle it methodologically, or that plays very important role. We may develop some protocols with deviational and exceptional methods, or these protocols are divided in major course and subcourse. What are the aims for this protocol? The dosha, dushya, mala, shrotas, and agni should function at its proper way. So here are some methods by which the proper management of emergency can be done in Ayurveda. Ayurveda can be split into three parts. First one is nano Ayurvedic practice. Second one is the preparation techniques. And the third one is administrative techniques. And in nano Ayurveda practice, you can see nano Ayurveda is a new term, but its utilization has been termed in Ayurveda for centuries. We know whenever there comes the name Resa, the first shloka which comes to our mind, Alpamatra Upayogitvat, Aruchir Prasangata, Kshipramarogya Daitvat, Aushadepyo Atigoresa. Minimal usage as well as the taste is also not differentiated, so it can be given for any age groups. And Kshipramarogya Daitvat, it is very effective and it is very fast acting too. Aushadepyo Atigoresa. And many of the Rasa medicines, Rasa Shastra medicines are prepared with nano standards that we can understand when we go into deep practices. And around 3 centuries or 3 decades ago, there was Ayurvedic injections which have been stopped. And among that, Vada Gajangusha Rasa, as one of my teacher told, it was capable of pain control during those times. But unfortunately, we are lacking all those. The second one is dilution of medicines. It is very practical to use the medical dilution and form emergencies. For example, in a few instances, we can see that oral medicines takes about 30 minutes to react at its target. If the same time is added with a vehicle like milk or honey, for example, it's carbohydrate, right? And diluted reaches within 10 minutes. At the same time, medicine pounded and added with alcohol, that means asava arishta, reaches the targets within 5 minutes. Alcohol or water diluted medicines are fast absorbed in GIT mucosa and reaches the target in 2 to 3 minutes also. We can easily practice all those things in our general practice so that we can clearly see the miraculous effect of our drugs. The third one is bulk medicine practice. When the crude herbs are practiced to tackle these emergencies, for example, the herbal juice or decoctions are prescribed along with saintava to facilitate the buffer action and fast absorption in either forms. Or even the oral route is also there, like kashaya or even the quadavis. The rectal route, the vasti, and the transdermal route, like avagaha or padishega, is also used. The other one is the nasal administration. Many neural diseases or the psychological conditions are dealt with rapid nasal administration. Here I have to stress on one more point. At starting, Agnihotri sir told that yes, of course, this proper clinical condition that we see as diseases or trauma is not only the emergencies. All the physiological conditions as well as the psychological one are also involved in our emergency. And here we can see that the Nasa Dhopan is very much effective in asthma, or even Shodhana Nasya is very effective in Pradishyayas. And Mahapana Nasya, Madhana Nasya is very effective in unconscious state, and Pratimarsha Nasya in hypertension. Here I want to share a small instances which I have experienced while going through a folklore medicines in and along the parts of northern Kerala. Once I went to one tribal colony and I saw one great person who was practicing the tribal medicines there. One cobra bite was happened, and he just identified the bite and identified the Visha Vegas, and he administered this type of Mahapana Nasya by putting some conical shaped things which are made from the leaves and put some powders into it, and had the Churnanasya type of things through the nostrils. And to our great surprise, the person was in conscious mode when he just counted from 1 to 10. So these things are very much there, but don't know how we have lost all those things. And another administration is the rectal administration. Here, a condition of unconsciousness state refers to the rectal administration of medicines, as the root bypasses the portal circulation, that is nothing but the Bhuta Agnipakam, and reaches the target soon. So the diluted alkaloid contents are faster there to absorb and reach the target in time. So the buffers like honey, Saindhava, Shatapushpa helps the drug to act faster and sooner. So the Vasti, how it is acting, is clearly we can correlate here. So the Vatahara drugs like the Sahacharadi or Dhanvandara Thaila as Vasti in status asthmaticus is very much useful in this or in these conditions, and the mode of action of these drugs are like this. Another one is transdermal administration. We feel that this route is not much in use, but Ayurveda practiced long ago with effective emergency practices in transdermal routes. I don't know how many of you have been heard of these things. Sharapunka Arka, which is a special Arka preparation, or even Arishta is also prepared with this Sharapunga. If it is administered or if it is externally spread over the surface, makes anesthetic effects of the parts, and it can be even prepared for surgeries, has been told. So what to be done, or how, what are the measures that we have to take care in particular for gaining or for maintaining these Athyayanika Chikalsa things? Athyayanika Chikalsa is nothing but emergency. Many scattered recordings have to be brought, and we have to have a separate chapter upon this Athyayanika Chikalsa. So a proper methodological validation of the evaluated formulas should also be there. And introduction of new time medications of traditional combinations such as intramuscular or intravenous injections can be done, or skin patches can be done, or even transdermal patches can also be dealt towards these things. Here, I would like to share 2-3 things regarding the emergency management. Every one of us are very much involved in headache and other things. If there is no other pathological involvement, then you can take puka, that is areca, and peel off its external kernel and just crush it and take the juice of that one and apply it over the forehead and the temples. You can easily manage the headaches. So these type of very mysterious and very effective things are available nowadays. We are not at all bothered about those things. Even in the case of BP that we will come, that is next, that is cardiovascular system. The common emergencies are, we know, it's the palpitation or the pain or the erythemas. Brihat Kasturi Bhairava is 100 mg. If it is used with the help of beetle juice as sublingually, it is very effective. Not only this one, if there is no availability of Brihat Kasturi Bhairava Rasa, you can opt for the great Yogaraja Gugulu. The Yogaraja Gugulu can also have these effects sublingually. It's a clinical practical knowledge only. And, nowhere in the Parashruti of Yogaraja Gugulu has been written that it can manage BP or something like that, but it's effectively manageable. I have been looking through many of the cases, and I has been noted many instances that if the BP is in higher stage, we can easily manage with Yogaraja Gugulu placing sublingually. And the action is within 15 to 20 minutes. And Akika Pishti, 100 mg, it is very much used along with honey for sublingual absorption. Akika is nothing but it is a different variety of Varatica only. So the calcium preparations is mentioned. And Dashamula Arishta or Arjuna Arishtam 30 ml, it's used in dilution for faster absorption. So these Arishta or Rasa, which are soaked in cloth application over the surfaces, facilitates rapid action. And there are so many other trucks like Triloki Chintamani Rasam, Magaradhvaja, Siddha Magaradhvaja, and Vadakulantaka Rasas and Dhanvantari Vati are very much used. And the correct adjuvant must be added to that for its proper administration so that the target is attained in a faster way. For example, I would like to share one more thing. In case of we have Gridhrasi type things, so there is radiating pain all over the body. So the efficacy can be increased with the help of so many adjuvants which are added to it, like the Nagara Churna or even pepper powder is also, because all these have the property to cleanse the channel and to improve the medical quality as a catalyst and to enhance its property and to reach its particular target organ. So it's very effective in these conditions. And in respiratory emergencies, we know the dyspnea or the obstructions are the common emergencies which we know. Any surgical complications can be treated with Hinkuvacha, the Karpuravati, or Shwasakasa, Chintamani Rasam, or Shwasananda Rasa, etc., can easily be dealt along with Kanagasavam, Pushkara Mulasavam, and honey. And it's very, very effective also in these conditions. And externally, Karpuradi Tailam Abhyangam, which is followed by Svedana, will make a better relief. When I was doing my house surgeoncy period in government Ayurveda hospital, one respiratory emergency came due to dyspnea, and it was easily managed with the help of Karpuradi Tailam Abhyangam all over the body. And in addition to this, Matravasti also plays a very effective role with the help of any Vatahara type of oils. In uremia conditions, the person who are having cow dung powder like on the forehead, that means the Gome Churna, we know they will die in 1 month as far as our Shastra is known. Even though the Mutra Virejana treatment is prescribed in many occasions, and it's found that it's incomplete to tackle the situation. So we undertake the patients who are undergoing dialysis and monitored with Vasti Chikitsa. The result is encouraging that the urea, the SGPT, SGOT, and the certain creatinine, and its clearances are regulating to its normal range. And after, and one more thing here I want to share. Last month, I had a patient who was having RA factor, which was raised much, and with the help of Kokilaksham, it was easily managed. And that patient was suffering for past 17 years with this problem, and it was effectively managed too. So the thing is, we have the thing, or we do have many of the properties and many of the things, but we are not at all enthusiastic enough to have those things in our daily practice. Either that may be because we don't have that guts to practice it, or we don't have belief in our tongues. And another one, the neurological emergencies, the hypertension, the diabetes, or the metabolic disorders influence along with the neurological disorders precipitate the stroke. Rasaraja Rasa, Brihat Chindamani Rasa, and the Yogendra Rasa, 125 milligram, in every 3 hours sublingually. I stress upon to the point sublingually will help the regulation of the situation. The Punarnavasava, the Mritasanjeevani, which is not available nowadays, but it is also very effective for fast recovery. And the Satya Prabodhana Nasyas with the help of Apamarga or with the help of Mundi will also, along with Vasti, is effective in these type of neurological cases. And here I would like to add one more thing, which I have seen my sir has been doing while he was practicing in one of the remote areas in Kerala. One stroke patient came and he just applied all over the body with the Shatadhauda Krita and also with one Kupipakwa Rasayana as Talam. And effective management was done within no time because it was remote village and we don't have any accessory to get that patient towards any multi-specialty hospitals. So these things we have to take in care, and emergency management is very, very, very effective in our Shastra. So because as a conclusion, when though we have examples of emergency management in Ayurveda, the practice is poor. Either it may be because of the non-availability of medicines or due to the exposure of emergencies in the curriculum, MSc. What we have to do is we have to develop the rapid pain management medicaments, the protocols like those analgesics and antispasmodics. And the faster sedatives, if it is given, the half management of this can be done with the help of sleep. And of course, the emergency management's half part is sleep itself. So proper mental remedies should be taken in care along with those we do have as medicaments. So both physical as well as mental aspects should be clubbed together to find a new variance for the treatment of emergency situation in Ayurveda. So thereby, the situation of emergency and the Ayurveda or emergency is totally controlled upon by the physician who is attending. So these all glimpses, what I have shared with you, should be taken to forward, to regulate, as well as to develop some certain protocols, as well as certain policies should also be taken from the governmental side to establish this and to give the forthcoming generation that, yes, with Ayurveda also you can have that management, not only physically, but mentally also. And that is the role of Ayurveda. So let everyone be having a good Ayu. Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani pashyantu. With these words, I would like to conclude my short presentation here. And I once again thank every one of you who have given me this opportunity to present this small topic. I'm stopping because I know the time is running and two other more eminent speakers are here to speak about this great topic. So I would like that in the near future, the opportunities would be there so that we can discuss this topic in details. Thank you, one and all. Thank you.
Thank you. Thank you, Dr. Ankush. Thank you very much. Very nicely presented and explained. No doubt. Our Ayurveda is not meant for one day. Our Ayurveda is meant for every breath, every pulse, and every second of the life.
Yes, sir.
Thank you, Dr. Pawan Sharma ji, and our great thanks to Dr. Ankush for his presentation. The one thing which I liked most and appealed for his presentation is his English pronunciation. I really love to hear it. It was giving the accent of American English and with the full authoritatively. Very, very important. It is a pleasure that persons. So many girls are there. So many have presented in English form, because in our days of say 30, 40 years back, it is very difficult. Those who have completed BSc, they were a little bit dealing with the English words. Otherwise, there is scarcity of Sanskrit language and along with the English. So your presentation in that way, it's excellent. Now, what you have presented, you have covered fullest area is very good. It would have been much better if you have underlined some important things like the Ayurvedic diseases,
Oh,
diseases
yeah.
diagnosed by allopathy like status asthmaticus or
Yeah.
dyspnea. Let us have our words.
Yeah, yeah,
Ayurvedic emergencies first, and second, if the oral route is not working. That is very, very
Yeah.
important. What will do your sublingual preparations like West, Beth, Kasturi, wherever solder, apart from Matravasti also. And again, when the patient coming unconscious,
Sure, sure.
the attendants are not in position to tell you thing, or the attendant is not. There is a simple rickshaw puller. And
Yeah.
on the way, one has got some accident or cardiac attack. So when he is brought to our hospital, what Ayurveda is going to do? Well, we know that our Ayurveda is always there to avoid the emergencies. Our think tank is there to avoid the emergency. But the emergency comes, then that would have been much better. Apart from Matravasti and other things, Abhyang, it's okay. Nasya is still of great work. But
Great work. Yeah.
so many things are there which you have been suggested and always there in the text, asking for the oral route. One thing you have just told that the subdermal application pichu is that one. So that is area to be added in your subject matter. So thank you so much for your
बहुत
presentation.
बहुत शुक्रिया। एक्चुअली मैंने सोचा कि टाइम बहुत कम है ना, इसलिए
No problem,
मैंने
no problem.
नहीं
Still
नहीं, ये
you are
प्लेटफॉर्म आपका
supposed
है,
to
आपको छोड़ेंगे नहीं हम।
remain. Yeah. आप बने रहिए हमारे साथ में, आप रहेंगे हमेशा. Thank you
Of
so
course,
much.
of course.
Over to Pawan Sharma ji.
Okay, thank you for the great
Thank
words.
you.
Thank
Thank
you.
you, Dr. Ankush.
Thank you.
Now I would like to request Dr. Rajkumar Wali, Assistant Professor, Department of Prasuti Tantra and Struri Rog, VLDA AVS Ayurved Mahavidyalaya, Vijaypura. Welcome. Welcome, Dr. Rajkumar. Welcome. आदरणीय श्री राम शर्मा जी को भी नमस्कार है।
Namaste, sir. Good evening to everyone. Is my sound audible?
Yes, yes. But focus on the face. Side
Okay,
focus is there.
1 minute, sir. Is it visible, sir? Oh,
You are visible.
okay. My audio, sir?
Yes, clear.
Okay. Thank you, sir. And good morning, everyone. And first and foremost, I would like to thank the organizers, Dr. Sharma, sir, Dr. Agnihotri, sir, and our Dr. Pramod Bargi, sir, and our principal for supporting us for this presentation. So today, I want to discuss about the management of trauma. So management of trauma has today, we are two speakers are there from the same college, myself and Dr. Aneesur. So I want to specify more clinically. So has sir previously also talked about the Ayurvedic medicines in some of the emergency conditions. So I want to talk more clinical appearance, how to diagnose the disease and how to take that disease, and how to somewhere we have some borders. So where the modern science fails or where the Ayurveda has to be worked on that. So today I'm going to deal much about the clinical examinations and how to take or diagnose the disease. And after that, we can bifurcate whether to go with the modern medicines or with the Ayurvedic medicines, and how we can manage with the Ayurvedic medicines. So sir will deal with that Ayurvedic medicine. So I will start my clinical presentation. So today is a World Trauma Day. So I have selected for the management of trauma. To manage the trauma, the main thing is we should have the clinical diagnosis, and we have to perfectly diagnose the thing. Then we can go for a treatment. So, and before starting my presentation, I would like to seek the blessings of Lord Dhanvantari and my Guruji, Dr. M.D. Samudri sir. So I want to take the blessings of them and start my presentation. So can I share my slides, sir?
Sure, sure, you can.
Is my slides visible, sir?
Clear, clear.
Okay. Okay. Myself, Dr. Rajkumar Wali, Assistant Professor, Department of Prasuti Tantra and Stree Roga, BLD AVS Ayurveda Mahavidyalaya, Vijaypur. And I am going to discuss on the management of trauma. So, introduction, what the word trauma is, what it means. The word trauma originated from the Greek word which means wound. Okay, the word trauma means it defines as a wound. Trauma can be defined, it is any type of distressing event or experience that can have an impact on a person's ability to cope or and function. So it is going to do the distress and event experience, so which is very sudden thing and which is not predicted. So anything which we have not predicted it before, so something that happens or which is going to impact on the person's ability to do his normal work and functions. So that condition we'll call it as an trauma. So next is, so there are types of traumas. So as when we study the traumas, so whenever an physical accident or a physical thing, we'll consider it as an trauma. But nowadays, the psychologically also we are considering it as an trauma. So acute trauma, it results from a single incident. So if the incidence is single, so that we'll call it as an acute trauma. So when the chronic trauma, when it is repeated and prolonged, such as domestic violence or abuse, so that we called it as an chronic trauma, so which is repeated again and again, so that is called as an chronic trauma. And complex trauma, it is exposure to varied and multiple traumatic events, often of an invasive interpersonal nature. So it is the multiple traumas, it may be psychological also and physical also, it may be mixed with that physical and the mental both if it is there, so that we'll call it as an complex trauma. So these are some of the things where the trauma is differentiated, that acute, chronic and the complex traumas. So common traumas and the types, that is griefs trauma. So whenever we have a sudden news of anybody's ill health or anybody's death or like that, so at that time, the psychologically, the grief trauma, the person goes sometimes into unconscious level or the blood pressure comes down. So that is a mental trauma or like that. So that we calculate as a grief trauma. And disaster trauma, the disaster trauma is if there is any injury or any injury to that person from the external factors, so that we'll call it as a disaster trauma. And childhood trauma, so any misbehaviors nowadays, so parents are compelling the children to study more and more, so that is giving them a trauma to the brain. So it is giving the stress factor and they are having completion of the trauma at the childhood. And the medical trauma, so which is the main thing what we are going to discuss, the medical trauma like the myocardial infarction or neurological disorders or everything. So sir has discussed previously in detail about it. And abuse trauma, so nowadays the government has made about the anti-ragging or like that, the abuse of the people or the society, so that is also a traumatic. And relation trauma, the relationship in the families or with the life partners, or that is going to cause the relation trauma. And war trauma, the war trauma means because of any external factors with the sharp injuries or any blunt injuries, so that is an war trauma. And the sexual trauma is any harassment of sexuality, so that may be the sexual trauma. And this is an anatomy of the trauma. So physical injury or the emotional insult, so that it may be of any physical injury also, or any of the emotional insult, so that is going to cause the body trauma and the emotional storage. So here the trauma, when we see in the broad spectrum, it is of the body trauma also, and the emotional storage also can be manifested. And it is going to manifest the pain, or it is going to manifest the pain and the inflammation and the tissue shortening and restricted movement. And it is going to make an impairment in the circulatory, congestion, pain, and emotional. So these all are the cycle which happens because of an trauma. It is not going to only cause to the body, and it is going to impair on the emotional storage, or it is going to give the emotional also. So in our Ayurveda, we tell that when the person is swastha, okay, and sharirika and manasika, both the swastha is going to play a role. In our Ayurveda, previously only they have told. So when the person is swasthya or like that, so the sharirika and manasika both are going to be having the equal importance, as in our Ayurveda they are told. So previously the modern science were not believing in that. They were only believing that medical science is only related to the physical thing or any physical traumas. But nowadays, when our ancestors has told previously in our samhitas or like that, so nowadays they are more focusing on the psychological, that is mental thing also, mental health also. So these are some of the traumas when it is happened to the traumatic to the brain injuries, that may be the stress factor or sympathetic drive. If it is to the spinal cord, any injury to the spinal cord or like that, it may be the paralysis, or it may cause the paralysis. And the abdominal trauma, if any direct injury to the abdominal or like that, it may cause the injury to the spleen, liver, gastrointestinal tract, and kidney. And the fractures are common in the traumas. The fractures are a common thing in the immobilization may happen, or any of the injury to the blood vessels, and that may cause the bleeding, and that may result in the shock and coagulopathy or acidosis. So there are hypothermia, like that the cycle begins. So in our acharyas has also mentioned, don't think that only our people or only the modern science has mentioned about the trauma. Nothing like that. Our Ayurvedic concepts also has told about the traumas. So only they have mentioned the many of the things, many of the diseases where the traumatic injuries, abhighataja. So when Acharya Shushruta is a person, whenever we take any of the type of diseases, he has told in that abhighataja. So which is an external factor, which is going to be an external factor that is going to play the role of the abhighataja, means the external factor or external agent which is going to cause the injury. So many a times we sorry. So many times we tell that only the modern science has explained all the types of the emergency medicines, emergency things, and traumas and everything. The modern people has mentioned nothing like that. In our classics also they have mentioned it, but it is scattered in our classics. So Acharya Shushruta, why he has been the at most or a superior in all of the surgeries are like that. So he has mentioned each and everything, and he has mentioned about the traumas and how it is the thing it is going to affect, and how it is going to be an progressive. And the Arishta Lakshanas they have mentioned, as a sir previously explained about it. So these are the things where we are going to deal with that. And when we see the modern thing or a modern science, when they speak about it, they speak only very specifically. How they will speak about specifically, and how it is injury has manifested, and how it is going to take places or like that. So our acharya has also mentioned it, but they are mentioned on the basis of dosha, dhatu, and like that they have classified it. So we are not in the stage so much thing to differentiate it or to understand the things. So some of the studies or researches has to be carried out to take a step ahead of it. So the physical trauma. So there are the commonly when we see in our OPDs or like that, the physical trauma is an important thing like that. The mechanical trauma in that, the mechanical trauma is of the blunt force or the sharp force. So the force which have maybe the mechanical, maybe the blunt force, anything the foreign body, maybe the blunt force or the sharp force, or any of the sharp foreign body is going to injure, that may be the mechanical trauma, or the thermal factors, or a heat factor or a cold factor. So this is also Acharya has told about this, the heat factor or a cold factor. Acharya Shishruta has told how it is there and how it can be the Agni Dagda, like that. He has told the frost bites or like that. He has told the previously Acharya has mentioned, and how it is diagnosed and how it is treated also as told. So electrical trauma, the electrical trauma also Acharya has told, the Indra Dhanush, like that, the electrical trauma we can compare with that. So radiation associated traumas nowadays, when we are exposed more to the radiations or in the radiation, as we use the mobile phones or like that, the gadgets, electronic gadgets or like that, so it can be associated or it is going to cause the traumas. So chemical traumas, that acidic or alkalis or the poison. So this acidic and alkalis, Shishruta has told about the Kshara, Agni. So like that, the traumas, what they are going to, Ati Dagda, Hina Dagda. So Acharya has told this. So why I am telling the modern comparison with that? So this is not a new concept what the modern people are telling. It is the old concept what Acharya has told, but they are given the proper format for that. So they have made it proper format to understand it. So our Acharyas also have told about this mechanical trauma, blunt and sharp traumas, and heat and hot, the thermal traumas, electric traumas, and acidic and alkalis, the poison. So these all traumas are told by Acharya Shishruta, as mentioned, very deeply. So, but we are not able to understand it, how the Acharya wanted to convey to us. So these are the mechanical traumas and the chemical traumas which are dealt here. And the external factors. So trauma is nowadays a common thing. When we see the hospitals or a bigger hospitals or like that, they have a different unit for that. The trauma care unit is there, and some of the hospitals, they manifest themselves to the external factors, that we have a very good trauma managing department or like that. So the main trauma, what will come it as a road traffic accident. So this is a common thing in the trauma, the road traffic accidents and the natural disasters which happens. Any of the natural disasters also are going to cause or the external factors for the trauma. The commonly again and again when we come across is the road traffic accident. So these are the traumas we are going to study here. The management of physical trauma. The management of physical trauma, how it is done is fast hugs. So the fast hug is an mnemonic. So when we take it as a mnemonic, but it is the thing when the patient comes to us with the traumatic, the physical trauma. So we have to be very fast, or we have to move to that patient very fast, and we have to give it a proper treatment also. So Acharya Shishruta has told about the quality of an surgeon, or the thing that there also he has mentioned the quality of the surgeon. So Ashukaritvat, it means the person has to be very fast and he has to react to it very fast. He has to take some of the steps which are very fast, and he has to treat it. He has to diagnose on the table, and the proper treatment has to go on. So this is the fast hug which is given the mnemonics by the modern science, and how it is going to impact, or when we are in the clinical practice. So this mnemonic we have to implement it. The F is the feeding or the fluids. So the first thing when the patient comes with the trauma or like that, the fluids has to be given. So whenever there is a shock, the person may go into shock or like that. So there, because of trauma or the thing, so the fluids has to be given. So the sufficient fluids are going to hydrate the person, or the hydration of the person is very important in the cases of trauma. That is analgesics. So sufficient analgesics has to be given in cases of trauma. So there the pain will be the pain will be very extensive. So for that, the analgesics has to be given. And yes, that is sedations. So the sedations, whenever the patient comes with an trauma, there are irrelevant speech will be there, irrelevant posture will be there, irrelevant activities will be there. So for that, the sedations has to be given. And thromboprophylaxis. So the thromboprophylaxis has to be ruled out. What is the blood investigations, and it has to be taken, the blood grouping and the bleeding time, clotting time, and any hematomas are there or like that, it has to be seen there. And hugs. So the hug is the head up or head low position when the hypotension or hypertension is there like that. So head up and head low is going to give more relaxation to the patient. And ulcer prophylaxis. The ulcer prophylaxis is there. So any injury at the time of the thing, if any injury is there or any of the wound is there, so for that the ulcer prophylaxis is very important. And the glycemic control, whether the hypoglycemia is there or the patient is hyperglycemic, so that has to be ruled out, the glycemic index of that person. Sometimes the patient may be unconscious because of the low level of the glucose, so that has to be ruled out. And the spontaneous breathing trial. So whether the patient is taking the breathing trial in the normal way, or he is having some distortion on the when he is taking the breathing, or tachypnea is there, so that has to be seen there. The spontaneous breathing trial has to be done. So this is a mnemonic, what is the fast hug. So our acharyas also have told about this, how the mnemonic, what they have told, and they have told how to manage it and what are the things they have to do. So for that, they have used the different modalities, or to given the that is scattered in the different chapters. They have scattered the things, so that has to be grouped up, and it has to be framed in a single context. So where the acharya has told about the and bandas he has told. So how the bandas, how at which position which bandas has to be used. So Abhighat has explained in all the type of diseases. He has mentioned about the Abhighata. And the Vruna also Acharya has told, that is a ulcer prophylaxis. So this has to be, this is a scattered thing in our Shruta Samhita. So that has to be clumped up to bring up this thing. So when we are in a clinical practice, when we are doing the fast hug, the mnemonics, which suggests, so the fluids has to be given. The first we have to stabilize the patient. So sir has told many of the cardiovascular diseases, and previously sir, when he has explained very wonderfully which are the Ayurvedic medicines can be given with that, and how we'll get a wonderful results. So to know that, or to give that, the first thing is we have to diagnose the patient, and we have to stabilize the patient. And after that, we can do that. The Ayurvedic medicines we can implement with that. And the primary survey. So when we have a trauma, the primary survey has to be done with, and the primary survey is to stabilize the patient. First, we have to stabilize the patient, and afterwards we can start the medications, or we can start with our Ayurvedic medicines, which are having wonderful results, as sir has told in the Pakshagata. I have also seen many of the patients in Kerala, also in the coastal regions. So they practice wonderfully with the Nasya. They treat most of the diseases, the poisonous diseases also, and most of the unconscious patients also, they treat wonderfully with the Nasya karmas. So that type, when we go to the more northern part of that, the Vedana karma or the Rakta Mokshanas, the Agni karmas, they do wonderfully in cases of unconsciousness, and the very active pain is there. So that conditions, they do the Vedana karma or the Rakta Mokshanas and the Agni karmas, they wonderfully practice there. So to do that, we have to stabilize the patient. So after that, we can do that procedures, or the Agni karmas or the Nasya karmas. So that is going to give a wonderful results. So before that, we have to stabilize the patient. When the patient is having a trauma, to stabilize that, we have to have this mnemonics A, B, C, D, E. So the A is the airway. So the airway or the cervical spinal immobilization has to be done, or the airway has to sing whether the airway is in the proper way, the airway is channelized, or there is no disturbance in the airway, or any compression is there. So the cervical spine immobilization, this is a very important thing. Most of the time when we see the trauma patients, the cervical spine is very important. So that has to be seen, and it should be in the immobilization. So when the mobilization is there, so that is going to do the compression of the cervical, and that is going to impact on the trachea also, and the patient may die on table. So that cervical spine immobilization is very important, and the airway has to be cleared, and the airway has to be seen properly. Next is the breathing and ventilation. So the person is breathing or any need of ventilation, so that has to be given, like oxygen has to be given to that patient for the proper breathing. And next is the circulation. The circulation has to be seen where there is any hematoma or any of the thing is there. So that has to be seen, or any injury to the cardiac or major veins or the arteries are injured. So that has to be seen. And D is disability, neurological evaluation. So this is very important. The neurological evaluation is very important in cases of traumas. So the which nerve is injured, or any of the head injuries are there, or any of the other neurological disabilities there, whether it has hurt any of the flexors or any of the vertebrae it is injured. So that has to be seen there. E is the exposure. The exposure means any of the other factors are there. So that has to be evaluated. So this is an thing is airway, the vocal response or auscultation, the chin lift. So this we'll study we have studied in our protocols of that, the breathing, the pulse oximeter, the mechanical ventilation. So circulation vitals has to be checked, and everything we have studied. In the neurological, the GCS score or the motor and the sensory examinations. And the cervical thing is very important. As I have told, the cervical is very important. And support of oxygen and the emergency, if it is needed, the support of oxygen has to be given, or any of the surgery, or if it is the patient has to be moved to the higher centers, that has to be seen. And exposure and the secondary survey. So the other investigations have to be done, and the secondary survey has to be performed. So this is the primary survey is, so we are not going to take, nowadays we have a guidelines that the person when it is come, so we should not take the other priorities. First, we have to stabilize the patient. When the patient comes to our clinic or a hospital, we have to stabilize the patient with the airway, breathing, circulation, and neurological disabilities and everything. We have to first stabilize the patient, and we can take when after that we can take the secondary survey of it. So the secondary survey, we can ask other histories, and other management of the vitals and everything can be done here. And the secondary survey, it deals with the focused history of the patient or the family. So any of the history that has to be asked. So some of the congenital deformity may be there, or any other family history may be there. So that secondary survey has to be done. So one of in my PG studies, when I was doing the PG studies, at that time in the night, we got a patient with the unconscious level. In the unconscious state, the patient has come to us, and we asked that the history to the patient. We are given the oxygen and everything. We are stabilized that patient, and we asked the history to the patient. What was the cause behind the unconsciousness, and what was his routine activities? They told nothing. He has went to the farm, and he has did his routine work there in the farm. So that person belongs to the farmer's family. So he has done his routine work, and nothing. Other than that, we don't have any history of that. They have told. So when the person has went to the BP and diabetic and everything, everything was normal, and there were no external injuries also. So what may be the cause for that and everything? So after that, when we started taking the deep history of the person, Then we got to know that he was spraying the pesticides. So he was spraying the pesticides from 1 week he was doing it. But after the 1 week, that was the cause for unconsciousness. That was causing the poison for that. It has turned to be a poison. So sometimes when we fail in taking the history, so we are not able to diagnose the thing. After that, we know that it was the cause behind was the poison. After that, we treated according to the poison. So if we have missed that concept, we were in the bad spectrum of it. The intervention, emergency intervention in parallel with the evaluation, the oxygen, fluids, vasopress, and anti-arrhythmic drugs and ventilators. So these are the emergency interventions which has to be implemented after the parallelly with the evaluation. This has to be given parallelly to stabilize the person. And targeted intervention has syndrome is defined antibiotics or analgesics. So if we have targeted and if we know the proper history and proper thing, we have diagnosed it, then we can go with the antibiotics or analgesics and refine based on responses to therapy and information. So on the basis of history or the other things, we can implement the therapy and assure timely response. So the timely, we have to deal with that. So here comes where our Ayurveda can be an boon to the person. So in the primary survey, so what the line of thing is, the airway and everything, we have to manage it, we have to stabilize it. And in the secondary survey, after seeing all this parallelly, we can go with the Ayurvedic science where the Nasya Karmas can be done and the Agni Karmas and the Rakta Mokshanas can be done. So here we can implement our Ayurvedic science here, which is going to give the wonderful results. With the modern science, we can give the Ayurvedic science. So where it can be a boon or it can be an effect to the patient, and the recovery rate or a recovery will be very good. So the recovery in our hospitals, when the Pakshagata or the paralysis patients were there to us, so first line of treatment, what we are doing, we are going to the CT scan, we are monitoring whether there is an internal bleed is there or any type of other things is there, or the GCS scale, we were monitoring that. And after that, when we stabilize the patient with all the vitals are stabilized and everything, after that, we are giving the Nasya Karmas and Abhyanga, Bastis, and sir also discussed about the things which can be implemented there. So like that, we were planning for the Nasya Karmas and the Basti Karmas and the Abhyanga. So this with that, and with that, we were getting a wonderful results. So with the modern science also and with the Ayurvedic science, we are giving the wonderful results, and the recovery rate was very fast. So the recovery rate was very fast. And sometimes where we fail also is there. So when we are not stabilizing the patient with the vitals and everything, we are not stabilize the patient. Only with the Ayurvedic science, if you are not very well abundant with that. So if you are giving the Ayurvedic treatment without the management of vitals, it may be vital to the patient also. So for that, you have to see the vitals and all the things, airway, circulation and everything. You have to stabilize that. And after that, you can go with the Ayurvedic management or the Ayurvedic managements with the Nasya Karma and everything. With that, Ayurvedic management can be implemented. So this is an GCS scale, how the GCS scale is. So what I think, what nowadays when we are coming up with that, and NCSM or the syllabuses also, they are more focusing on the modern diagnosis, and we have to clinically diagnose the patient. Then we can adopt our line of treatment or the line of medicines can be implemented. With that, the GCS scale is very important. So when we have a trauma or a head injury or like that, so the GCS scale is very important to rule out and which stage the person is like that. When the E, that is I, that is E4, V5 and M6, we'll consider the GCS gradings of it. The first is I response. When the I response is there, so when the patient comes to you or when we see that if there is no response, then we'll give the gradings as 1. So any response to the pain, so when any response or the up and down of the opening and closing of an eyes, So that we call it as an 2 grading. And 3 grading to the speech. If the person is able to, when you give anything or when you voice command you are giving, so to that react, if he's opening his eyes, then we'll call it, as an 3. And spontaneous. The spontaneous means only to the external factors. If the person is moving around or like that, so to that factor, if it is opening his eyes or like that, everything is normal, then we are giving it as an 4 grading. And the verbal response means how that patient is going to talk, or how the patient is going to give the response. So to that, one is no response at all or incomparable sound. So some of the sounds the patient will making, so which we cannot compare with the sound. So that is grading 2. And inappropriate words. So sometimes he starts telling some words which are which we are not appropriate. So that we'll call it as gives the grading as 3. And 4 is the confused state. If you ask some question and the person will reply in another thing, so that is confused state, will give as a 4. And 5th is oriented to time, person and place. So whatever the questions you may ask or like that, if that person is responding in a way, that is 5 grading. And the motor responses, so the person is not responding at all, is 1. And abnormal flexion means the person is moving away, the extremities are moving away, the abnormal extension, so that is 2. And abnormal flexion is there, so that is the 3. And flexion to withdraw from the pain, the person is taking the hand or he's moving away or giving the response to that, it is the flexion to withdraw the pain, that is 4. And moves to the localized pain. So if we pinch here or pinch here, so if his hand, if he's bringing to that site, that is localized pain, or that person is going to respond to that. So that is the 5th grading. And 6th is if he's responding to the command, or when we say something to lift his hand or to lift his leg or like that. So if he's responding to our command, then we'll give it as an 6 gradings. So here, so when we take this E4, V5 and M6, so this is the GCS scale when the neurological impairment is there or any neurological injury is there. So in this, the gradings we'll give. So these are gradings where we can say that whether the mild injury is there or the major is there. So it is a normal injury to the neurologically, it is there. So on that basis, we can diagnose the person whether he is having any impairment is there. So in which grade that person falls, so that can be done with this. So this is very important. When we clinically, we have to diagnose the patient. So we have to say that whether it is in the 1st grade or a 2nd thing or a second, or whether the intubation is needed or any other thing is needed. So for that, it is very important to know the GCS scale. And on that basis, you can diagnose the thing. And after that, the GCS scale or a grading is good, then we can go with the Ayurvedic line of treatment. So if the GCS scale is very low, below 4 or below 5, then we need some of the modern sciences. So to stabilize the thing, we need some of the medicines, which are the life-saving inotropes or the medicines. So with that help, so we can stabilize the patient. So that is very important for the person to stabilize it. And after that, we can go with the Ayurvedic line of treatment. And this is VSA scale. So whenever a patient or a trauma is there, the first thing we have to think of managing the pain. So this is a very important thing when we see that. So whenever the patient comes to us, so whichever the disease may be there, whenever the patient is suffering with the pain, that time only the patient comes to us. So if there is no pain, let it be however big the disease may be, however chronic the disease may be there, they never come to the doctors for that. So whenever the pain is extreme, which is not bearable, when the thing is there, so at that time only the patient comes to the doctor, or they come in search of doctor. So whenever a trauma is there or like that, whichever with the extreme pain, the patient may go into the unconscious level also. to another complications also the patient may go into. So the intensity, location, the onset, and the duration and variation and quality, it is very important. The pain has to be differentiated on the intensity, localization, onset, and duration and variation quality. This is very important, where to grade the type of pain the person is suffering. With that gradings only we can say that the patient is in the distress or unbearable pain, or on that grading we have to differentiate that person. And after that we can manage the pain. The pain can be managed after that with our Ayurvedic medicines, like the gugulus can be given, or any other type of localized thing can be given. So that type of procedures can be done. So the pain management is very important in cases of an trauma. So for that we should have the gradings of it, and the GCL scale, the neurologically scales are very important to rule out or to know the intensity of the debility there. And my conclusion with this thing is the management of pain is very important in cases of traumas. So the first thing, whenever a trauma is there or like that, the management of pain is very, very important. So that has to be the first thing when we started practicing, or when we start practicing, whenever the patient comes with a trauma or like that, we have to first focus on the management of pain. So if you are giving the relief of pain to that patient, then we can manage the other things. And next is the management of vitals. The management of vitals are the very important things. The blood pressure and the heart beat and everything, that respiratory rate and all the vitals has to be managed. So oxygen rate or SpO2 rate has to be managed with that. And next is management of disability. The management of disability, if there is any injury to the bones or any injury to the other vertebrae are there, or any of the injuries are there, there we can do, or we are going to do the management of disability. So that has to be very important, giving the support to the cervical, giving the support to the back, or like that we have to do the management of disability. So when we see some of the cases, so in our Ayurveda they are told like an Abhyanga or the Basti has to be given or like that. So following that protocol, sometimes what the people will do, they start doing the Abhyanga in the rural practice or a folklore practice. They don't know which site they are going to do, which type of Abhyanga has to be done, or like that. They randomly do it. So that is going to aggravate the disease, or that is going to aggravate the disability. So that has to kept in the mind. So if we diagnose the disability, then we can plan for which type of Abhyanga can be done, whether it is to be done localized or Sarvadahika Abhyanga has to be done. So that has to be known for that. And management of complications. So whenever a trauma is there, so it is not going to be only a single part of a trauma. So that is going to be a cause for the other complications also. When it is neurological, that may be going to cause the another impact on the cardio or any of the other systems also, that is going to cause the complications. So that has to be seen there. It is not going to be associated with the other things. So that has to be managed there. Next is the management of post-trauma complication. So this is a very important thing. We have to do more work on this, the post-trauma complications. Like the person goes into a stress factor, or the patient has the disability, permanent disability may be there, or the function loss may be there. So here, which our Ayurveda has given wonderful things, or contributed many of the things in the post-trauma complications. Like when the trauma is there, so there the stress factors will be more. The patient will have the stress factors will be there. So there the Sarpagandhavatis or the Sumanas tablets, so other Chandanasavas. So there are many of the drugs which are going to Ushirasava. Like that, the drugs which are going to be neurologically, which you are going to impact on the stress factors and reduce the stress factors, and the post-trauma complications can be wonderful boons. And the lepas, in cases of the fractures or like that, the lepas, Dashanga lepa can be applied, and other lepas can be applied where the pain intensity will be very less. Murvinnadi taila can be applied. So in such cases or the post-trauma complications, where our Ayurveda is giving a wonderful results in that, and the Lakshadi Gugulu, many cases we have seen with the Muruvinadi Tela, Lakshadi Gugulu, and the fracture cases are there, or like that cases, it is going to give a wonderful thing. And the post-trauma complications like that, there's insomnia is there, like that the patient comes with the insomnia or like that. So where the modern medical people will give the sedatives or like that. So there is no need of going for a sedatives in that conditions. We have a wonderful medicines where the we'll give when we give that medicines, there are good results, like Nasya can be given, the Abhyanga can be done for the post-trauma complication. So where the field is open for us to contribute on this post-trauma complications. So before the in the initial stage of trauma, so where we can take the help of the modern science, where we can establish with that, and we can diagnose the disease, and we can stabilize the patient. And after that, the complications or post-trauma complications can be managed with that. In this, the Sharma sir were telling about the COVID-19 or like that. So many of the people with the Ayurvedic medicine, we have treated good number of cases with that. With the extensive use of the modern medicines also, there are post complications of COVID-19. So for that, we can restrict the things where the modern science cannot, medicines can be restricted, but the investigations and the diagnosis, the diagnostic tools, what they are using. So that is, I think, in my perspective, when we are doing or when you are diagnosing the treating the disease, like the modern tactics we can use for the diagnosis of the disease. And the first thing, like an first aid or like that, we can use the modern techniques of that. And after that, we can go with the Ayurvedic management. We have wonderful Rasaushadhis are there, Kashaushadhis are there, and the Panchkarma Chikitsas are there, and Marma Chikitsa, one of the main boon in the Marma Chikitsas, where you can get the wonderful results in a minutes of or a fraction of time. I have seen many of the patients. My Guruji was practicing where the Agni Karma in the back pain or like that. We was going to give wonderful results with the Agni Karma or like that. In the Gridrasi, where the patient was not able to walk also, there the Rakta Mokshana was giving a wonderful result with that. So my way of the aspect of my presentation is, so in the first thing when the trauma is there or like that, diagnose with the modern techniques, with the diagnose the disease and have the proper investigation of the disease, and use the modern techniques for that. And medicines, we can implement the post thing, or with the Ayurvedic medicines, we can manage it with the wonderfully, we can give the results to the traumatic patients. So don't, we cannot think that in our Ayurveda emergency medicine is not there, emergency, nothing like that. We have wonderful medicines which are used in emergency, where the Acharya Shushruta has mentioned in many of the diseases, where the Kukshi Patana, one of the, to open the abdomen in cases of LSCS or like that, Acharya Shushruta has contributed to that. So where we are lagging in that, it is scattered, that pointer is scattered. So we have to make in that scattered knowledge into a compact of it. So where we can implement in the cases of emergency and trauma. So remaining part of the Ayurvedic concepts, Dr. Aneesur will deal with that. So thank you everyone for your patience hearing. And I would like to thank once again for all the organizers who have given this opportunity for me to keep my view on this management of trauma. And my thanks to our principal, sir, Dr. Sanjay Kadlimatti, sir, and our vice principal, Dr. Shashidhar Nayak, sir. And special thanks for them for supporting me for this presentation. And my heartful thanks to Dr. Pawan Sharma, sir, Agnihotri, sir, and our Dr. Pramod Bargi, sir, who has supported me. Okay. Thank you, everyone.
Thank you, doctor. Thank you very much. You have nicely explained. Great. बहुत अच्छा प्रेजेंटेशन था आपका, बहुत ही अच्छा. दोनों आज के दोनों स्पीकर्स ने हम लोगों को इंस्पायर किया. ग्रेट.
थैंक यू सर. थैंक यू.
अग्निहोत्री सर.
जी नमस्कार. थैंक यू. Dr. Rajkumar ji, you are really presented very well. And important point that you covered the whole of the area along with its importance and its description. You very precisely described the whole of the area, especially touching the fullest concept of trauma from modern medicine, and then the importance points to be noted at the time of attending the emergency that is being raised by you, especially the management, especially the diagnosis if possible, and then the management. As far as the pain management is one of the important point you raised, and also insomnia or sleep or something of the sort. But sometimes, as far as the when head injury is concerned, and you have not seen coming blood from nostrils or throat, then it becomes a problem that it might be collecting inside the say means skull itself. So just to avoid the unconsciousness and a weight of the awareness as and when the patients may recover, we used to tie that sedatives are to be avoided, because in sedation it will be difficult to have the proper response as far as this thing is concerned on based on the modern medicine or so. But our Ayurvedic remedies which are there to taste out are really miraculous. Especially, I'm just remembering one point that in case of a snake bite, if a people leaf with its peduncle is taken then and there and put inside to the deepest of the means ear drum, it turns into black, and just it gets black. So it is said that the this venom toxicity is taken by this people leaf, the ashwatha bruksha leaf. So there are so many things which are scatteredly available, but that depend that how presence of mind is there attending physician, and how much capable he is having the so many remedies there. So your contribution is wonderful. Thanks a lot, and you have to go high and high. So such type of topics are not only of theory use, it is to be practiced and when as and when you get. So thank you so much. Over to Pawan.
Thank you, sir. Thanks.
Thank you very much. Thank you, Dr. Rajkumar. Please do join every
Thank you,
day.
sir. Thank
We
you.
will be circulating you. Whenever you have
Okay,
time
sir.
and
Sure,
topic
sir.
of your choice, do join. And we will be
Thank you,
inviting you.
sir. Thank you.
Thank you.
Thank you, sir. Thank
So now I would like to request Dr. Aneesur Rehman Madni. Welcome, Dr. Aneesur. Welcome. Please unmute yourself.
Thank you, sir. Thank you much. Thank you very much for inviting me. Let me start the video. Is it audible, sir?
Yes, clear, loud and clear.
Okay. So, first of all, I would like to introduce myself. I am Dr. Ankush Madni, Associate Professor in the Department of Postgraduate Studies in Shalyatantra at BLD ABS Ayurved Mahavidyalaya Vijaypur from Karnataka. Today, on the eve of World Trauma Day, and on the behalf of Independent Research Ethics Society and the series of conference series which has been conducted, the AYUSH SAMRIDDHI, by the whole team of IRES, I would like to first of all congratulate the whole team for conducting such a huge event, I can say, which incorporates almost various aspects related to AYUSH. So I would like to congratulate first. Nextly, I would like to thank the organizing committee and Dr. Agnihotri, Dr. Sharma, and all other organizing team for giving me an opportunity to talk on today's topic, that is AYUSH in emergency. Let me start the session. Let me share my slides. I hope the slides are visible.
you. Not.
Okay. Is it visible?
It's not, no.
Just a minute, sir.
Sir, share your slides. Anees sir, share your slides.
Yes, sir. Is it visible, sir?
No, I'm just
Naam is not.
you check the connections with your presentation tablet or laptop.
एक मिनट हॉल प्लीज 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 इनवाइट क्या कुछ प्रॉब्लम आ रही है?
स्लाइड्स नहीं स्टार्ट हो पा रहे हैं।
नहीं शेयर करी, मुझे व्हाट्सएप कर दीजिए तो मैं कर दूंगा।
हाँ, yes, yes. Dr. Anish, if you can send your presentation to the Dr. Pawan Sharma's WhatsApp, he will start, he will manage. Hello, you are listening me?
Okay, sir. Can I have a message or can I have a contact number, sir?
You can share the WhatsApp on the WhatsApp, Dr. Pawan Sharma ji. You are not having? I'll just.
Anees, you send to me. Anees.
Anyone you can just make a.
आप मुझे भेजो, मैं सर को भेज दूंगा।
Okay.
Just to save
Okay, you send me, I will send to sir.
Okay, sir. Okay, just a minute.
Or शर्मा जी, आप अपना नंबर बोल दिए, मोबाइल नंबर डॉक्टर अनीश जी।
उन पे है मेरा, अनीसुर रहमान पे तो मेरा नंबर है।
हाँ, पता नहीं वो अभी उसको टेस्ट कर रहे हैं, अपने लैपटॉप पर है।
अनीसुर जी पे तो मेरा, मैं तो उनको सर्कुलेट कर रहा हूँ।
Just a minute, sir. Just a minute. I am sending.
वो आ रहा है, आप तब तक अपना मुंह से चालू रखिए, मैं स्लाइड चालू कर दूंगा।
Okay, sir. Just a minute.
आपने भेज दिया?
हाँ, अभी प्रमोद बर्गे सर को भेज रहा हूँ सर। एक मिनट, वो नेटवर्क इश्यू है सर, थोड़ा कनेक्ट नहीं हो रहा है, अभी भेज रहा हूँ मैं।
Anish sir.
Yes, sir.
Myself Sridhar sir here, Dr. Sridhar here. Your voice is also breaking.
Okay, I'll check the network. सर बर्गी सर को भेज दिया है सर मैंने।
आप पवन जी को भेजिए ना, शॉर्टकट हो जाता। अभी तक वो चालू कर देते ना। आपके पास उनका मोबाइल नंबर, व्हाट्सएप नंबर है?
नहीं सर, वो नहीं मिल रहा था, वो डायरेक्ट लैपटॉप में कनेक्ट किया है ना मैंने, तो भेज दिया है अभी। आई जस्ट शेयर इन अ मिनट।
ಎಲ್ಲಿಂದ ಶೇರ್ ಮಾಡಪ್ಪ ಜಲ್ದಿ ಬಾ ಇಲ್ಲಿ.
टॉपिक ಮತ್ತೆ ತಂಪ ಬೇಸಿಗೆ ಇಡ್ಬೇಕಲ್ಲ ಅವಕ್ಕ ಬೆಟ್ನ ಹಗಲೇ ತೆಗಿ, ಹೊರಗೆ ಬಿಸಿಲಾಗ್ತಿಲ್ಲ, ರಾತ್ರಿ ಅಟ್ಟೆ ಹಾಕ. ಅಷ್ಟೊಂದು ದಪ್ಪಿಲ್ಲ, ದಪ್ಪದ ನಾವು.
Moreover, you start your talk. He will
Okay,
send
okay,
to
sir.
Yeah, so that.
Okay, sir. Meanwhile,
yeah.
Until the PPST is being shared, I'll just start my talk today. Today I'm delivering the session, or the topic is Ayush or Ayurveda in emergency. The same topic that has been discussed in the first two sessions. But the thing is, the first session was completely related to the Ayurvedic terminologies and Ayurvedic concepts, and the second session was related to trauma, beautifully presented by Dr. Rajkumar, Wali. I would like to congratulate both the previous presenters, Dr. Ankush and Dr. Rajkumar. Now, as a third session or the last speaker for the day, now my duty is to
पवन सर आपको भेज
merge
दिया,
both
देखिए
the things together. Yes, sir.
You continue, please
पवन
continue.
सर को भेज दिया मैंने, व्हाट्सएप कर दिया.
To merge both the things in the last session of my presentation, that is Ayurveda in emergency. Whenever we come across this term emergency and Ayurveda, so there is a general concept, there is a general notion in the public or in among the people. Ayurveda and emergency goes what do you say, contradictory or opposite of each other. Okay, so they think that Ayurveda is everything.
Are you sharing?
As a science of life, that it includes all the aspects. It doesn't leave any stone untouched.
ತಿಮ್ಮಾಪುರ್ ಸರ್ ಅನ್ಮ್ಯೂಟ್
And
ಮಾಡ್ರೆ.
along with that, emergency
Timapur
part
sir,
is
unmute.
also being.
ತಿಮ್ಮಾಪುರ್ ಸರ್ ಅನ್ಮ್ಯೂಟ್.
Yes, sir. So thank you, sir, for sharing the slides. I had a technical problem here to share it, but it's being visible now. So I would like to begin with the availability of the descriptions in Ayurvedic texts related to emergency. So let's begin with the definition of emergency according to modern. What does it mean? Emergency is a sudden, urgent, unexpected, usually an unexpected occurrence or an occasion requiring immediate action, as per the dictionary. And coming to the medical dictionary definition, it's an unexpected development or situation that endangers life or limb and requires immediate action. So this is the definition of emergency, where sudden unexpected thing occurs and requires immediate attention and immediate action, where time is the most precious thing. You cannot wait there. You cannot do the upeksha of that condition. That's an emergency, and these emergency may require assistance sometimes from the person who is nearby, or especially from a person who is qualified to handle such situations, like a physician or a casualty medical officer who is able to handle situations or conditions like this. Next slide, please. Yes, next slide. Yes, coming to the myths and facts about the notion or the opinion among the public that Ayurveda can only treat chronic conditions and not acute diseases. And this belief or this myth is completely wrong, and it is misguiding and devaluating Ayurveda. The awareness among the masses is not to an extent to bring about the clear idea about what Ayurveda contains and what it can deliver to the public. So from the text of Ayurveda, it's very clear that even emergency diseases as well as acute conditions were very well treated and has been documented in the Samhitas, in the Ayurvedic management of various conditions. We come across so many instances where we come across the terms like Sadhya or Ashu and Twarita or even Daruna types of terms, which gives a direction towards emergency or the need of immediate attention towards that condition. So these terms or these aspects in the Samhitas give a very well idea related to the availability of emergency management in Ayurveda. Next slide, please. So after coming to know about the definitions of emergency, I would like to begin with this quotation, a very famous quotation from both Sushruta Samhita and Charak Samhita, that is, Akriyayam dhruvo mrityuhu kriyayam samshayo bhavet. This quotation or the line of shloka is available both in the Samhitas, which has been described in Ashmari Chikitsa by Sushruta and Udara Chikitsa by Acharya Charaka. Both of them have explained the importance and have highlighted the emergency management in that particular condition where the surgery was about to be has to be conducted, and without the treatment or without the chikitsa, it will lead to mrityu, it will lead to the loss of life. And with treatment or with that surgical procedure, it may be doubtful that the mrityu will occur. There may be chances for the survival of the patient. So this quotation itself reflects from both the Samhitas, it has been taken, and along with that, the next part of the shloka tells you about the consent and the things that the physician has to take as a decision, consent from the authorities, from the person or the attenders, and he has to take the proper action because of the condition, that is akriyayam dhruvo mrityuhu itself tells the exact definition of emergency, even in the today's medical dictionary, where he explains that emergency means it may lead to the loss of life or limb. So emergency is in Ayurveda is not a new thing. In the previous in the first session also we have come across these things, but I'll just briefly tell that the primarily approach of Ayurvedic system resides around the managing of the balance of three doshas along with whatever the disease has been occurred to the patient, but the balance of three dosha has to be maintained. And some text of Ayurveda, most of the in situations they have discussed about the emergency conditions also. The literature of Daruna and Ashukari diseases, wherever the context of Daruna and Ashukari disease has been explained, it is in the respect of this emergency scenario. The Nidana, Dosha, Dusha, and if it vitiates very strongly or rapidly and together, all together, then these diseases may have a strong manifestation and can be considered as acute diseases or emergencies. So when the Nidana to Samprapti up to this period, if it is a very short time, that leads to a very grave situation or symptoms that requires an emergency or immediate treatment. So that has to be managed. And Acharya Charaka has described that an upadrava, which is more troublesome condition rather than the disease, and it occurs when a diseased person gets affected by another disease. So an emergency condition arises in such condition where there is a lack of resistance power or the Vyadhikshamata. So even the upadrava and also the Daruna Vyadhis can be considered under the umbrella of emergency. Next slide. So the term Tvaraya Jayet has been mentioned in so many conditions and so many instances, which explains that the approach of Ayurveda for prompt treatment or prompt management of medical emergencies such as hyperthermia, that is intense fever, or acute diarrhea, acute migraine or severe migraine, trauma, gynecological emergencies, burns, poisoning, or cardiac arrest, and various other emergencies has to be overcome, or you have to win those situations by immediate action. That is Twaraya Jayat has been included. So this gives a very clear idea that emergency is not a new thing to Ayurveda. It has been dealt, and we can even imagine, but logically also, if we think the period of Sushruta or Charaka or the Samhita period, when we are talking about the Samhita period, what the people were suffering from were not only the chronic diseases, but also they were suffering from the injuries resulting due to warfare, injuries or trauma caused due to the attack of animals, poisonous creatures, or during any of the natural calamities. So those were not the chronic conditions which were managed by Ayurveda. Those were severely acute conditions which required immediate attention, and those references are available in the Samhitas, how it has to be taken care of. As our previous author, Dr. Rajkumar, explained the concept of the lightning stroke of a lightning, how it has been told as asadhya. But even though asadhya, what treatment can be given has also been mentioned along with that. Even in cases of sunstroke, or even in cases of drowning, even cases of burns, even so many poisoning cases and all other cases where Twaraya Jayat has been mentioned, means emergency is not a new thing to Ayurveda. That's the bottom line of this slide of my presentation. That is where he also tells about the Rasoshadis, use of Rasoshadis, very well told by our first speaker, Dr. Ankush, related to the sublingual route, the use of medicines in emergency practice, because the patient may not be conscious in those conditions. It does also the various routes of administration of medicines by Vasti, Nasya, Lepa, gives a very detailed idea regarding the conditions, emergency condition, as well as their management by Ayurvedic approach. So coming to the next slide related to this. Coming to the types of emergency related to medical science, though there are so many types of emergency that one may face in life, as our host Sharma sir and Agnihotri sir were discussing, that there may be financial emergency, there may be some social emergencies, there may be emergencies in so many situations. But when we come to medical science, the emergencies can be divided into medical emergencies, surgical emergencies, gynecological emergency, and one more thing that can be added is the medical legal conditions like burns or poisoning, such type of emergency, even some natural calamities, emergencies occurring due to which occurs in a large scale, that can also be included in this type of emergency. So these are the emergencies which a hospital or a healthcare center can come across. So out of that, the medical emergency that we come across here, I have tried to make a correlation between the modern conditions and the Ayurvedic references available for those particular emergency conditions or the acute conditions. The diseases of medical emergencies are like the typhoid state has been explained as Tandrika Sannipataja Jwara Bhava and the Pralapaka Sannipataka Jwara Bhava and Akshepa. All these are the 18 types of Sannipata Jwara which have been explained. Each one of them has a specific feature or the symptom which correlates with modern conditions, like we have the febrile delirium, we have febrile convulsions, we have the infective parotitis mumps, which is correlated with the Karnika Sannipata Jwara. Then Tivra Sannipata Jwara has been correlated with the hyperpyrexia, where the temperature shoots more than 105, 106, or even more than that. Then Shitanga Sannipata Jwara Bhava has been correlated with the subnormal temperature or the crisis. Then Shosanaka Santamaka, Shwas Santamaka or Pratamaka types of Shwasa has been correlated with fever with dyspnea. So these are the modern correlations of these medical emergencies. We have read about these modern diseases, but its counterpart is also available in the Samhitas, where it is being treated in the according to the lines of Jwara. So the next slide, please. Few more conditions apart from Jwara, we have Tivratisara or Raktatisara, which direct correlation we can understand easily by the severe diarrhea or the bleeding per rectum. Then we have the Apakshaya or the dehydration, which has been correlated. Then Mutraghata can be correlated with the retention of urine. Visuchika is correlated with the gastroenteritis. Shwasa, which is a very emergency situation where we need to take care, we have to pay attention. correlated with bronchial asthma. Pratamaka and Tamaka Shwasa has been correlated with asthmatic bronchitis or the status asthmatic. Then Hridshwasa has been correlated with the cardiac asthma or the whooping cough. Next slide, please. So these are the modern conditions which we are well aware of because of the terminologies being commonly used. But the Ayurvedic correlation which is available and has to be considered are not so common, except a few diseases like we have the Chardi and Rakta Chardi is correlated with the vomiting and hyperemesis or the hematemesis. Actually, the Rakta Chardi is the hematemesis. Then related to Hridroga, we have so many acute conditions or cardiac emergencies like myocardial infarction, coronary heart disease, or the angina. It is correlated with the Hridopaghata among the Hridroga. And Hridbhed is the heart failure or the cardiac failure or the heart block condition is correlated. Then Rakta Chapavriddhi is the hypertension. Generally, we come across the hypertension, which is correlated along with the Rakta Chapavriddhi. Next slide, please. So these are the various medical emergencies like Mada Mocha Sannyasa, very important aspect where the patient is unconscious in Sannyasa and even in Murcha Avastha. So it is correlated with unconsciousness. Brahma, which is a not a grave emergency, but still very troublesome for the patient, giddiness or vertigo. And the Sannyasa, it may be any sort of coma. It may be diabetic, a uremic, or a hepatic coma. So different types of comas have been considered in the sannyas. So when you come to sannyas chikitsa, there we get the references of tikshnanasya and various other chikitsa upakrama for all types of coma to bring back the consciousness of the patient and to save the life of the patient, because coma is a situation where if we not handle immediately leads to the loss of life. Next we come to the Udara Roga, where Tivra Udara Shula has been correlated with the acute abdomen. Advana, Shula, in which the Tuni Pratituni concepts, though my might have studied while the description of the diseases, but these are actually the colic pain of the renal colic or the biliary colic has been correlated with the Shula. Then Udara Shula in general is maybe the appendicular or the intestinal colic. Then Antar Lohita condition, very important, internal hemorrhage due to any of the causes like the perforation of the ulcers or any other esophageal varices or any of the cause which leads to internal hemorrhage has been considered as Antar Lohita. So the lines of treatment of that particular condition, Antar Lohita, has to be encountered. This correlation, the intention of giving this correlation is the aspect of emergency in Ayurveda is so vast that individually one or two topics or diseases you can present a whole session with that particular disease or condition. All these conditions have been explained extensively so that it can be managed based on the lines of that particular disease. Like we have the Chidrodara, which has been correlated with perforation, intestinal perforation. The line of management for Chidrodara has been extensively described in the Sushu Chikitsa Sthana, where he has told the use of the Krishna Pipilika, the ants, for the purpose of suturing the intestinal perforation. So the line of treatment is to close that perforation by means of a surgical method. So that itself is the line of treatment even today practice, but with the method is different, but the principles remain the same. So the line of treatment of all these conditions is available in Ayurveda, but it has to be adopted according to the lines of the present day scenario. Next slide, please. Apart from medical emergency, we have so many surgical emergencies also, like the Vrina, Bhagna, the Antravriddhis, the Pranashtashala and Visarpa. I've just limited the condition or the diseases to very few because the list goes, a very long list goes. If you come for Sadhyavrina or even the Bhagna, you get a lot number of diseases explained in the first two chapters of Chikitsa Sthana by Sushu Samhita, where it explains the whole methodology and the line of treatment of whole Shashti Upakrama for the Vrina, the Vrina. That too, when you come to the Agantuja Vrina, that is the different types of traumatic ulcers, the line of treatment has been mentioned separately apart from Nija. So the importance of Rakta Srava Stambana or the stoppage of bleeding, hemorrhage by the Chaturveda Rakta Stambanopaya, where there is a method where even the dahana used, the use of cautery or by application of heat, the stoppage of bleeding that has been told is basically to to save the life of the person at that is the first intention there. Next is to treat the disease afterwards. So the action in case of an emergency situation, the priorities is very different. The priority is to save the life and to control that situation, to bring back to the stability is the first concern there. So many situations, like we have the pranastashalya, foreign bodies, we may have the bullet injuries, we may have the blast injuries, so many earthquakes, or even the in case of any foreign body in the body which enter in the body by means of any natural orifices, or it has entered through a trauma, has to be taken care of, and how it has to be removed, what are the principles, extensively has been described. So each and every concept is extensively and very vastly described here. Next is the gynecological emergencies. We come across so many gynecological emergencies in the practice, especially the ati pravritti, raja pravritti, that is menorrhagia and metrorrhagia, the garbhasrava and garbhapata, very common. We come across the abortion or the miscarriage, the conditions which we are encounter in the prasuti OPDs. Then pushpa darshana, that is threatened abortions, garbhini rogas, diseases during pregnancy, a lot number of diseases during the pregnancy, and very importantly the muda garbha, complicated or emergency situation in case of a labor during emergency, or in case of the labor, if it's an obstructed or a difficult or complicated type of labor with a transverse lie or any other complication which may be fatal for the life of mother or for the life of the fetus. How to tackle such type of emergency and what decisions has to be taken considering the situations and the symptoms has been described very beautifully by Asha Sushruta, and he has included Muda Garbha in among the Astamahagada also. So that describes how grave the situation is. Next slide, please. Next, coming to the medical legal emergencies like Agni Dagda, Vishapita, and Sarpa or Vishchika Damsha. The treatment aspect of all these conditions, what you have discussed, I'll briefly discuss in the coming slides. But this is just about the correlation. Agni Dagda has been correlated to the burns or even the scars. Then Vishapita is the poisoning, internal OP poisoning or any other types of poisoning internally. And Sarpa or Vishchika Damsha is correlated with the snake or scorpion bites or any other poisonous creature bites, or Damsha is correlated with the Sarpa or Vrishchika Damsha. Next. Now coming to the principles of management of this emergency situations. See, the lines of Ayurvedic management of emergency once again relies on the identification of dosha involved. Though saving the life of patient is the first priority, but the how to manage or what line of approach should be there, it has to be firstly the dosha involved. Usually, most of the time, it's the vata which is involved in case of an emergency situation. Then discriminate the differentiate between Guru and Lagu Vyadhita conditions. Sometimes the patient may not be suffering or may not have an acute condition because of Lagu Vyadhita, because of sattva of the patient. He may be depicting like a very acute condition. So that has to be differentiated by the physician. Then resuscitate the vitals. Vitals has to be taken care of. The respiration, the heart rate, the pulse, and the BP has to be monitored, and has to be even the saturation has to be under the normal level, has to be brought in under the normal level. That is the first thing that has to be taken care of. Later, you have to pacify the vata, as it is the main dosha involved in case of an emergency situation, most of the emergency situation. Then the major things has to be attended first, like if there's a bleeding, or if there is unconsciousness, or if there is any severe pain which is causing trouble to the patient. Those things has to be taken care first, and the minor things or minor symptoms has to be taken care later. Later on, the treatment, the established treatment for that particular condition has to be administered. This is the line of management. First, you have to take care of these things first, assess the condition, go for the priority and save the life of the patient, manage the vitals, then go for the diagnosis and its treatment. And along with that, you have to also maintain the normalcy of the dosha, dusha, agni, srotas, and mala later. So this is the line of management of an emergency situation according to IRES. This is the in general line of management. Next slide, please. Coming to the mode of drug administration. As our previous author, Dr. Ankush, has explained beautifully related to the mode of sublingual administration of drug and even the nasya. The same thing I was about to tell related to the polykalpas. So many polykalpas which have been used sublingually have been giving tremendous results in case of emergency situation, especially in emergency situation. Not only a polykalpa, so many even other rasaushadhis. I will be describing the formulations later, but so many dravyas are used sublingually, even the medicines through nasya, even through basti. Basically, the para are apart from oral route, other routes like basti or even the suchi through intravenous or even the rakta mokshana like things and lepa, which has been discussed by the previous authors or previous presenters. I'm not going to take much time over this. So next slide, please. So Nasya, bioavailability of the drug here is more compared to the other means of administration. So metabolism occurs very fast when it is given through a necessity. That's why the even in case of sannyasa or even in case of the unconsciousness, nasya is a very important mode of administration of the drug where we can give it through nasal route and it is absorbed immediately and the results are very quick here. Next slide, please. Next is the basti, the rectum, which has a very rich source of blood supply as and the lymph supply. So whatever the drugs which are administered through the basti are very well absorbed and acted. That is why even in case of loss of bleeding or the loss of blood through any means of the body, rakta basti, the concept of rakta basti has also been advised by the acharya, as though it was blood transfusion has not been mentioned. Rakta basti concept because the nutrients or the essential blood cells or the plasma can be readily absorbed immediately through the rectal route. The importance here is the route of administration and the drug that you introduce through it. So all the references related to the basti, that's why basti has been told as Ardha Chikitsa. Even in emergency situation, when the oral route is not so good because of the time taken for the action, basti and nasya plays a vital role in the management of an emergency situation by Ayurvedic line of treatment. Next slide, please. Now coming to the formulations, while referring to the drugs for emergency, I came across these three formulations, particularly the Hemagarbha Potili Rasa, the Trailokya Chintamani Rasa, and Suvarna Sudshekar Rasa. These three rasaushadhis have been extensively used in case of acute and very severe conditions because of their very multidimensional effect, I can say. Multidimensional effect on the heart, on the respiratory system, and to bring back the conscious on the senses, on the indriyas, and also on all the other systems. So in case of emergency, these three drugs specially, I have come across these references. So the practical usage has to be once again verified and validated and has to be documented properly. But the references that I've got related to the use of these rasa in case of emergency is very extensive. That is why I just highlighted these three formulations in the drugs for emergency. Next, we shall discuss the different drugs for different conditions. Next slide, please. Yeah, these are the formulations for the treatment of acute conditions of asthmatic attack. It may be a status asthmaticus or any types of shwasa. You can go for very simple formulations like the herbal tea of ajwain, tulsi, and pepper, along with ginger. It acts as a natural expectorant. It brings out the kapha which is left around the bronchus, and even the yasti madhu can prevent the airway obstruction. Pepper, honey, and onion juice. These formulations has been working well in case of the bronchoconstriction. Along with the gum of asafoetida and honey is also used in asthma. See, honey is very good in conditions of expectoration, as it does the chedana of kapha. It is used extensively for shwasa vikaras. That is why even Sitapaladi churna is given along with honey in case of the chest congestion, as it removes the kapha. Kantakari have a very famous formulation, Talisadi churna, in case of allergic bronchitis. Then Vasarista as an expectorant in case of cough as well as in case of the shwasa. Then Padma Patradi Yoga, which has been proved to be increasing the peak expiratory rate, the flow rate. Expiratory flow rate can be increased. The lung capacities can be increased by these formulations. Even Shwasa Putarasa and Shwasa Sudharana. These are the formulations which can be tried in case of minor to moderate, mild to moderate forms of asthmata. You can see the results. It gives beautiful results. Even in case of common cough and cold, in case of COVID-19 also, we have come across so many simple formulations which proved to be very effective in case of relieving the chest congestion, for relieving the respiratory distress and all these things. So these are apart from this, there are so many formations. I have just listed a few which can be tried even in acute conditions or even in emergency situations of respiratory system. This can be tried. Next slide, please. Yes. Next, coming to the fevers, as we have discussed so many emergency situations or emergency conditions of Sannipata Jwara, or related to typhoid fever or so many other types of fevers. There is a list of these are the simple formulation that we can try. Nowadays, whatever any type of fever, we go for the paracetamol. But the amount of good that paracetamol does, it also has its own side effects, as it is a liver toxic drug. Okay, hepatotoxic drug. So we have so many simple formulations and these medicines which are very effective in case of jwara, like Pravalpisti. We have the Godanti Bhasma, simple single drug Tulsi powder, or Giloy Sattva, that's the Amrut Sattva from the Guduchi that we prepare. Even Tribon Kirti Rasa, Shadanga Paniya, so effective in case of jwara that just by the use of repeated use of Shadanga Paniya throughout the day without the intake of any medicine, any diet or food, just on the Shadanga Pani itself, you can bring down the fever in a single day just by the use of Shadanga Pani without any of the drugs, which contains only 6 drugs. I think Musta, Parpata, Ushira, Chandan, Udicha, and Nagar. These 6 drugs boiled together with water, you can prepare at the home, not necessary to get it from any pharmacy. You can prepare at the home and you can just administer to the patient or person. We can bring down the fevers. Apart from that, if there are severe fevers, you can go for Pravalpisti, or you can go for Anand Bhairav Rasa or Tribon Kirti Rasa. Rasoshadis acts very well. These Rasoshadis especially acts in the condition of fever. But along with that, you have to manage the line of Chikitsa of Jwara also. That is Langana and all Dosha Pachana has to be carried out along with these medicines. That gives a very good effect in case of fevers. Next, the management of cardiac emergency, which was thought to be very impossible by Ayurveda. You can go with very simple formulations. These are the references I got from some articles which proved to be having very good effect in case of cardiac conditions. The formulations like Hingu Churna along with Lavan and lemon juice. Hingu has been in almost all formulations. Hingu is said proven to be very good in cardiac conditions, along with Lavana to increase its or decrease the time of effect. Lavana is added as it quickly spreads. Then Hingu along with Gokshur Panchamula. Then in case of Bilwadi Panchamula, then along with so many drugs, Shunti, Palasha. So all these formulations are working in cardiac emergency by either clearing the passages, Srota Avrodha, removing the Srota Avrodha, and improving the cardiac output or cardiac function. So based on these lines, this cardiac emergency we are able to manage by these drugs. Next slide, please. Yes, next slide, please. Is it audible? So meanwhile, I'll try to continue the slides here. Next is after the management of the cardiac emergency, we have the surgical emergency or the trauma, which has been dealt by our previous speaker, by the surgical emergencies or the traumas by means of surgeries, various conditions like the Nasa Sandhana or Karna Sandhana, which is described in Sushu Samhita related to the reconstructive surgeries, or even anorectal surgeries. Sometimes the patient may come with some emergency anorectal conditions, like thrombosed pile mass is there, or a prolapsed piles is there. So even in anorectal surgeries, in case of emergency, can be managed. The conditions or surgeries like Baddha Gudodara, Chidrodara, or urinary system related, all the surgeries which require immediate attention, like acute conditions is there, acute appendicitis, or even in a case of torsion of testis is there. All these conditions has to be acutely managed, and it has to be surgically done. The medicine doesn't work here. It has to be managed surgically. So the surgical treatment for these things has also been described along the lines, but it has to be done along with the present day availability of equipments, medications, and the anesthetic drugs that are available. Along with that, we can very well handle all the surgical emergency. And beyond the laparoscopic surgeries are also being carried out at our Ayurvedic institutes. That's a very good thing that recently we came across the news of successful laparoscopic cholecystectomy has been being performed. So it's a new milestone in the field of Ayurveda, that the surgeries, the modern surgeries, or even the major procedures have been conducting at the institutes, so that the students in the upcoming generations in the Ayurvedic field can cope up with the present day scenario. Next slide, please. Next, the management of poisons or bites. I'm not going to take much time with this, because the whole of Chaturvimshati Upakrama has been explained. The 24 Upakramas by Charaka has explained related to how to manage the poisons, and there is a whole Kalpasthana has been dedicated by Sushu Samhita related to the management of Visha and Visha Chikitsa. So I'm just going to skip this, but I'll just like to highlight the later use of the Prativisha or the antidotes, Mahagadas, or different types of agadas that has been mentioned by Sushuta, can be tried in so many this poisoning conditions to overcome the acute effect of poison. The use of the Venika Bandhana, or even just by taking an incision at the site of bite, can help in so many situations, so many poisonous conditions. That is a sort of Rakta Moksha at the site, can help to counter the poisonous effect. So with this, I want to like to move to the next slide. So after all this, I would like to conclude today's session, as we are running short of time. So I would like to conclude the session by the few points, like to the aspect of the present day is to understand the sutras of Ayurveda in the modern light, which is the need of the hour. Because when the public or the masses are talking in the language of modern science or the terms, you should be able to cope up with them or explain them in that own language. For that purpose, though the principles, medicines, or the line of treatment remains the same, but it has to be spoken in the language of the people who are in need of the treatment. Along with that, to formulate a standard protocol for the management of emergency, this has to be formulated from the authorities for particular conditions, like if you have a cardiac arrest, or if you have a respiratory condition, acute condition, what is the protocol? What has to be done? Number one, number two, number three. So that protocol has to be formulated in the institutes or at the higher levels, and it has to be formulated and evenly it has to be followed in all the centers. So that will do the uniform treatment of Ayurveda in each and every part. It shouldn't be different in different conditions. For that purpose, a standard protocol management for the treatment of emergency should be formulated. I hope the NCISM in upcoming days will take, I think they will come up with the standardization of so many treatments, so many protocols, considering the way of work that has been continued after the formation of NCISM. I'm sure they'll come up with this. Next thing is to put them in practice. Practically, it has to be implemented into the patient, and the results that are being we get through those practice by the implementation of these protocols has to be published. Whatever the results we are getting, what modifications or what corrections we require. So it's not a single day's task. It has to be it's a journey. It's not just a destination. It's a journey that has to be continued until we reach, we sync with the people and Ayurveda, it has to be synced together. And we, being the fraternity of Ayurveda, should become a linking gap, link in the chain between the masses and the Ayurveda. And the thing is, the convener or the people who convey the message of Ayurveda should work with courage and confidence in Ayurveda. Then only we can succeed in what we are trying to achieve. So with this, I'd like to thank all the organizers for providing me an opportunity, and our institute, the principal of our institute, Dr. Sanjay Kadlimati sir, and Dr. Pramod Bargi sir, who made it possible for us to deliver a session on this IRES Samriddhi. And I'm very thankful for all the organizers and all the audience, the fraternity of Ayurveda, for a patient listening. Thank you, one and all.
Thank you very much, Dr. Aneesur Rehman. Very nicely explained, very great subject, summarized, no doubt. All the three speakers are inspiring, and this will open a new avenue in Ayurveda. I am confident. I am absolutely confident. You youngsters are developing a new pathy of Ayurveda in emergency. And if society will believe us on emergency treatments like villages, because in villages, generally emergency treatments are being handled by senior persons of the family and through Ayurveda or Unani, whatever we can say. So thank you very much. I would like to communicate my sincere thanks to Dr. Baragi and to Dr. Pundrikaksh for recommending beautiful expert speakers on the topic. Thank you very much, Dr. Aneesur. Agnihotri sir.
Thank you.
Thank you, sir. Thank you, Pawanji. Our great appreciation to Dr. Aneesur Rehman Madni ji. Very naturally, you revealed all the...
आपकी भावना पूरी कर दी सर, जो आप कोरिलेशन की बोल रहे थे.
I'm just going to appreciate this thing that Dr. Aneesur Rehman, being surgeon, he pointed out all these factors which are there in our text. So he revealed all available text and principles that the myth and doubts along with the facts are very easily be removed with the help of the available text. And lastly, what he told, though he categorically pointed out all the medical emergencies, including medical emergencies, surgical emergency, gynecological emergencies, and medical legal emergencies, along with their proper management. But the last sentence he told that to understand the Ayurvedic principles in modern lines. And you see, this is what the modern persons are doing. You are surprised to note that all our text is been taken in that way, that every instrument, everything is mentioned in our Social Sangita. They are using simply, it is a change in the base money from stone to wood and wood to steel. So the shape and the action along with the principles are always there for suturing, for bandaging, for everything. So and they very reluctantly, not very politely accept that Acharya Shushruta has been the father of surgery. So as far as the Char Sutra application has already been added in our Valley and Love edition, promoted by Professor Deshpande sir and Professor G.C. Prasad sir, K.R. Sharma sir. So these things are very important, Professor Elam Singh sir. So these things are very important. You people, now you are, the whole command is in your hands. So it's very important that how you are projecting. So you have got a full command over your text and subject. And I do hope that the pectoral hand is also very good, because for surgeon, pectoral hand is a must. So with these words, I think your appreciation must be held by all the persons, and your principals are, your vice principals are, and your reference persons are really to be appreciated, and we feel indebted for their contribution. Thank you, Dr. Aneesur Rehman.
Thank you.
Over to Pami Sharma ji.
Thank you.
Thank you, sir.
Now
Thank you very much.
I would like to request Dr. Pramod Bargi ji. Welcome, Dr. Pramod ji. Welcome. Dr. Gangadhar is with us. Dr. Pramod is with us. Welcome, welcome. Dr. Pramod ji, Vargi ji. Am I audible to you?
Yes, sir. Yes, sir. Yes, sir. Audible.
Welcome. Your comments on the day.
Hello.
Hari Om. Yes.
Hari Om, sir. Hari Om. I am audible, na, sir?
Yes, clear.
Okay, sir. It's my pleasure to talk on today's program regarding emergency and trauma, which is held today. All the speakers, all the three speakers, young and dynamic, and all three are expertise in their own subjects. They share their experience along with the classical references, along with modern references, and all those. It was really a wonderful combination of all the three speakers who were well versed in the subjects, and it was we all are blessed to hear all these youngsters who are coming with all this comparison with Ayurveda. So their experience they have shared in the young age, and they have vast experience, which they have learned in their institutions, and also they are practicing in the institutions. So it will be the development of the individual along with the institutions, along with the development of Ayurveda. It plays a very, very important role that youngsters are really working hard. You also worked hard for the development, and due to the improvement in the technology, they are also using sophisticated instruments to diagnose and all those. So we can only see that our science is going to flourish in these young people hands, and in already you have tried and you have flourished, and we see a much more brighter future in these young hands. These are my comments, sir, which I can talk on. Thank you, sir.
Thank you, Dr. Vargi. Thank you very much for recommendation, also for your involvement also. Thank you so much.
Sir,
now I would like to request Dr. Gangadhar Timupurji. Welcome, Dr. Gangadhar ji, head of the institute. Welcome.
Thank you, sir. Thank you. Hari Om.
Hari Om.
Yeah, all the three presentations were too good today. Actually, this is a need for all of us to know the medical emergencies. It may be a Ayurvedic way of treatment, or it may be allopathic way of treatment. But the first care should be taken of the patient. Any system of medicine it is, but the first care is taken to have the patients. Means we need to attend the patient to overcome that emergency. So that is must. And later on, when the patient becomes stable, then we can treat with our Ayurvedic science, or if he's still in emergency condition, then we can continue with that allopathy medicine only. So all the three speakers spoke well, and indeed this was a need of our. So that's all my point of view. Thank you, sir.
Thank you, Dr. Gangadhar. Tomorrow is World Menopause Day, and we are inviting 4 speakers on the topic: Dr. Divya PS, Dr. Anjali, Dr. Anagha, with Parul Joshi. So we are inviting 4 speakers tomorrow. Please do join tomorrow. Now session is open. If anybody would like to suggest for emergency anything. Agnihotri sir. Now I hope no comments are there.
Thanks.
So we can conclude the session.
We are hardly 13 are here, and out of them we would like to call some very important persons, those who have really attended such type of medical or surgical emergencies and managed by Ayurvedic treatment with their views, experiences, and suggestions. So in this connection, I would like to have the very precious suggestions from any of the persons who are available on our platform just now. Dr. Meenakshi Dev Chaudhary is there. After a long time, she is there. If she is having any say experiences and suggestions. Hello.
Hello, good evening, sir.
Yeah, good evening. Good evening. Yes, please.
Regarding experiences, my uncle once he was a case of irritable bowel syndrome. So after having stroke, he was admitted in hospital, and there was he had gastro. I mean, he was being given intranasal feeding. So at that moment, at first he was okay, but then he had severe episodes of diarrhea. So doctor could not control it. In fact, it was not controlled. So they called gastroenterologists, and gastroenterologists also those drugs were not responding much. So then what we did before at home, whenever he used to have that severe diarrhea, we used to have Jatifaladi Sangrahani. Yeah. So that drug, my uncle's relative told the doctor that we used to give him Jatifaladi Sangrahani, and it used to work. So I discussed with the neurologist, and he said, "Okay, it's fine. How will you give?" I said, "We'll give you by the tube." So that medicine was made into powder. Then it was mixed with this one darlene juice, and it was put inside a tube. And after we used to give him at intervals, and it stopped. So so I feel that the medicine which he used to take daily, means at home when he was not a case of stroke. Later, when he was admitted in hospital for stroke, and the doctor, the same drug given by pipe acted very well, and there was no adverse effect also. So this is from my practical applied experience.
Thank you, Dr. Nilakshiji. It's great that there you found the real value of Ayurvedic preparation, that too in such type of medical emergency. Your experience is really appreciable, and it can be re-established by any of such situation. It has got a confirmation by your this contribution. So that's why we are interested to have more and more experiences, practical experiences, family member experiences, or the experience of the hospital over the patients. So in the same connection, I would like to call some of our senior persons having experience managed by them in terms of the medical emergency. So in the same connection, I would like to ask Dr. Josna Pivaragi if she is here, or then I've got for example, Malagati. I don't know whether they are the students' presence with the direction of the today's guest speakers, and we are very much here as our respected Domaji in a reserve form, because it is 9:45, and most of the speakers are here. I would like to know one thing, that since Aneesur Rehman is here, and our guest speakers, out of our guest speakers, only he is there. So I think he may have some feedback out of the his own presentation. Anything is, if it is left out, which might be remembering in his mind, he can take a few minutes to make more, say, vital the experience which he is carrying with him, especially the OT emergency experience. Hello.
Hello.
Yeah, Aneesur, have you got any such type of OT experience? Means abruptly falling down the blood pressure during the operation, or any sudden, say, vomiting, though the precautions or pre-operative say instructions always it is said that there should not be anything taken before, say, night, or there should be nil orally. Even otherwise, sometimes because of the presence of the hydrochloric acid, there may be a vomiting. So how you manage such type of clinical emergencies in operation theater itself. Hello. Hello. Dr. Aneesur, you are listening me? Yes.
Hello. Yes, am I audible, sir?
Yes, you are audible.
Yes, sir.
So you got my point? Network problems here. Your voice is not perfect.
Yeah. So the just
You can join with your mobile itself.
be back in a few seconds.
Since your presentation is over, you can join with the mobile facilities. So that will be probably not having such type of discontinuity in the voice.
I think it's raining in Bijapur, sir. That's why Madni sir can't join. Sir, I want to share my views regarding.
Sure, please. I am in need of. I am failing to point out the names those who are interested. That's why I openly appeal that persons, since we are very less in number, please come by your own. It will be a support to us.
Okay, sir. Literally, I have seen and I have experienced this, sir. From Bijapur, about 17 kilometers, I am a farmland. Beside my farm, there is a Vaidya, they call him Vaidya, who is traditionally practicing since from ancestors. So whenever I am free and Sunday I visit my farm, I see the patients of snake bites and cobra bites patients who are coming to get treatment from that Vaidya. He is not qualified. He is a Paramparika Vaidya who are treating from their ancestors. Their great grandfathers were also treating. This Sunday, yesterday only, when I visited my farmland, beside my farm only, it is attached with the border. A patient of snake bite visited, and that person was not there. He was he has gone outside. They called him by calling only on phone, by chanting the mantra. He removed the snake bite from him. And when I discuss with him, when I go, he comes and he talks with me. Doctor Saab kaise hain? He talks with me. He has become a good friend of mine. He's a Vaidya. He also practices our Ayurvedic medicines. He treats the Sandhi Vata and all those. He will be asking about Ashwagandha and all those, whatever researches are going on in Ayurveda. He's a good friend of mine. He told me, I asked how you learned all this. He was telling that we have this mantra siddhi since from our grandfathers, and we are treating. And even when he is not there, he's out of station, his mother, even his daughter and his sons also treat these snake bites and all those by chanting the mantras. So literally, I have heard and I have seen him practicing this, sir. So, even I have heard that they have some Anjana. He said that we apply Anjana. In Sushruta, we get the reference of Anjana, application of Anjana in cobra bite and snake bite, where the Krishna Sarpa Anjana is used, prepared and used for these snake bites and all those. So there are, these are remaining in, or some Parampara Vaidya are following, and they are treating the patients without any, they are not taking any money or greed. They just, they tell to put in front of God, they put 100 rupees, some put 500 rupees, some 10 rupees. They are not doing like that. And they are not eager to get this all money and all those. So they do it as a seva, sir. Jan seva. So that parampara is continued till today also in most of the villages and all those, the rural areas especially. This is my practical experience with
Thank you, Dr. Pramodji. A great and what a miraculous experience and
Ji, I hope line is disturbed. So now I would like to communicate my sincere thanks to you all. Thank you very
Thank
much.
you, sir.
Please do join tomorrow. Please do join tomorrow.